Jeane Chartrand. I'm a CRNA, which is a Certified Registered Nurse Anesthetist. You pronounce anesthetist anesthetist. I have a master's in nurse anesthesia, and I worked in the ICU with a bachelor's in nursing and applied into the program after getting critical care experience working in post-op cardiovascular recovery as a nurse. I applied to a school in Naples, Florida, and graduated about 10 years ago. So I've been doing nursing for 15 years and 10 years as a nurse anesthetist. A typical day for me, you can work in different settings. As a nurse anesthetist, you can work in a surgery center, you can work in a hospital. At this time, I currently work in a hospital here in Corpus Christi, Texas, and we basically know our assignments for the day, what kind of cases we're doing the next day. We have like a GroupMe app, so we use that a lot to communicate. I show up to the OR, get the room ready, make sure the ventilator's working, do a standardized check, make sure I have all my supplies, and then I basically draw up drugs for the case. Currently, I work with anesthesiologists. Sometimes as a CRNA, you can work independent, most likely in a rural area. But here in Corpus, I work with another doctor. I work with an anesthesiologist. So he or she will usually see the patient, and then we'll collaborate when we do a plan of care for the patient. As far as anesthesia management, we usually take the patient back to the room, hook them up to the monitors, and let them breathe some oxygen. We get them off to sleep. We can either put a breathing tube in, or we use what's called like a plastic device, which is an LMA. And they just it's a little device that sits in the back of your throat, and they just kind of breathe in the gases while the surgeon does the case. Then after that, wake up the patient, and we send them to recovery. So with the COVID situation, we've have been helping out with intubation, central lines in the unit, and as well as arterial lines, just to help out because it was so busy back in July. Thank goodness our case count is going down, so we're not doing too much COVID management in the ICU. As far as what made me go into the field is I just have always been intrigued by the human body, sciences, and as a nurse, you interact with the patients and their family, and I just really enjoy getting to know people. And even though I do anesthesia and I put them to sleep, in a smaller town, you tend to take care of someone's grandmother, someone's father. So it's not just about putting someone to sleep and waking them up. You usually establish some sort of connection with them, depending on what kind of surgery they're having as well. As far as my classes in college, high school, I took college prep. You have to have a high SAT to get into nursing program. Basically, the science classes is what I had to take. I didn't have to take physics, but I did have to take that in anesthesia school. I did have to take a year of chemistry, biology, and do well in those courses in order to get into anesthesia school. So I made sure my GPA was really high, and I made sure I got the right experience in the unit and the right recommendations from the right surgeons. So when I went back to school, I did have to give up about 2.5 years of my life, acquired some loan debt. It's just busy. They don't allow you to work, and yet you don't get paid like residency program pays the residents. In this particular situation, we don't get paid. We weren't earning a paycheck. So the extra activities I did, I was like vice president of the Nursing Students Association at the college that I went to, which was a community college, to get the RN, and then I went back online and did the BSN. But the only activities I did was the vice president. I was really too busy because I have 2 children and they were school age at the time, so I was busy with them. I didn't really do a lot of activities outside of school, but any kind of activity out of school would help. I did work in the hospital a little bit as a tech, telemetry tech, where you monitor the rhythms, the heart rhythms, and you report it to, if there's a situation where it's a lethal, obviously you're going to report it. But I worked in telemetry and also as a nurse's aide, which I feel was pretty good experience to prepare me for this field. As far as studying and preparing for school, you just have to be focused and not let anything distract you. Taking care of yourself is pretty important. Exercising, staying fit. Did a lot of that in anesthesia school. If you pursue this nursing anesthesia, it's now a doctorate degree. So I was grandfathered in. I'm not required to have a doctorate. The classes that would help you, definitely math, because we do medication dosages, we do mixed drugs. It's important to know, do very good in pharmacology. But you're going to have to probably take physics and chemistry and math and do well in that. I would recommend maybe volunteering in a hospital or just working in a hospital as an orderly or a nurse's aide. It's always good to get involved in sports, music. That always looks good. Another thing, to be successful in school, you should review your tests and ask for any help that if you don't understand something, ask the teacher. There's a lot of resources out here to help you anyways, with the internet the way it is. But I definitely would review the test and understand understand why you missed any questions on the test, and then ask the teacher for some more help. There's nothing wrong with asking for help and getting a tutor. Other than that, as far as being a nurse anesthetist, you have many options of where you can work, what kind of schedule you would like to have. If you want to take call or not take call, you can choose a position where you work in, labor delivery, where you put the epidurals or the spinals in. I tend to stay out of that area because I don't like to be on call. I don't like to stay overnight in the hospital because they usually stay there for 24 hours. Here in this Corpus hospital that I work at. Of course, with COVID, everybody has a different role, and we have we're on the front lines and we're more at risk. So it's very important to be up to date on the the current standard of care for diseases, especially like COVID. Other than that, if you guys have any questions or you want to talk to me in person, I have no problem with you emailing me, or I'll even talk to you on the phone. I think anesthesia is a great career field. We have an opportunity to, I didn't mention this, that we are able to do peripheral nerve blocks, where you block the nerve. For like a total knee, you'll do a block, and that's very helpful for the patients and their recovery. So there's more to anesthesia than just putting someone to sleep. And sometimes we have to take care of some really sick patients. So sometimes we're doing, anesthesia for somebody that has colon cancer and they're having some of their intestine removed. And you do have to have empathy, and you do have to just have that basic empathy for people. The AANA is the American Association of Nurse Anesthetists. If you get on there, aana.com, they have a lot of information too about what our role is. I think I might have a few videos out there. Best of luck in whatever y'all do.